Understanding stroke. A stroke, also known as a cerebrovascular accident, CVA, occurs when there is a disruption in the blood supply to the brain, leading to damage or death of brain cells. When it comes to treatment, time is critical. Stroke is a medical emergency. Symptoms come on suddenly, and every minute counts. The longer someone having a stroke waits to get treatment, the higher the chance of permanent damage or even death. There are two main types of strokes: ischemic and hemorrhagic. Ischemic stroke. This is the most common type of stroke, and it occurs when there is a blockage or clot in a blood vessel supplying blood to the brain. The blockage can occur within the blood vessel or travel from another part of the body to the brain. The symptoms of an ischemic stroke can include sudden numbness or weakness in the face, arm, or leg, usually on one side of the body, confusion, trouble speaking or understanding speech, difficulty walking, dizziness, severe headache and loss of vision in one or both eyes or partial vision. Hemorrhagic stroke. This type of stroke results from bleeding in or around the brain. It can be caused by a ruptured blood vessel, hemorrhage, or abnormalities like aneurysms. Symptoms of a hemorrhagic stroke can be similar to those of an ischemic stroke and may include sudden severe headache, nausea, vomiting, and seizures. Understanding signs of someone having a stroke. Stroke is the second leading cause of death worldwide, so it is important to detect the signs of someone having a stroke early for a better outcome. BEFAST. Use the acronym BEFAST to remember the signs of stroke, and what to do if someone near you is experiencing them. BEFAST is the acronym reiterating the importance of quickly recognizing the signs and symptoms of a stroke. Identifying symptoms and reacting quickly helps ensure early arrival to the hospital for assessment. B. Balance. The letter B stands for balance. Watch for a sudden loss of balance. Check if the person leaning to one side or is unstable when walking or standing. E. Eyes. The letter E stands for eyes. Check if there is a sudden loss of vision in one or both eyes. Double vision that doesn't go away when you blink. No side vision or vision above midline. F. Face. The letter F stands for face drooping. Ask the person to smile. Check if the smile is uneven, or if one side of the face droop. A. Arms. The letter A stands for arm weakness. Ask the person to raise both arms. Check if one arm drifts downward or if there is numbness and weakness of that arm. S. Speech. The letter S stands for speech difficulties, sudden difficulty in speaking or understanding. Check if the person is able to repeat a simple phrase. See if the speech sounds slurred and garbled. T. Time. The letter T stands for time. If you observe any of these signs in yourself or in someone you are with, then it is time to call the emergency services. Prevention of strokes. Healthy lifestyle. Adopt a balanced diet that is low in saturated and trans fats, cholesterol, and salt. Include plenty of fruits, vegetables, and whole grains in your diet. Maintain a healthy weight through regular exercise and physical activity. Control blood pressure. High blood pressure is a significant risk factor for strokes. Regularly monitor and manage your blood pressure through lifestyle changes and medications if prescribed. Quit smoking. Smoking increases the risk of stroke. Quitting smoking can significantly reduce this risk. Limit alcohol consumption. Excessive alcohol consumption is linked to an increased risk of stroke. If you drink alcohol, do so in moderation. Manage diabetes. Keep blood sugar levels under control if you have diabetes. Regular exercise. Engage in regular physical activity to maintain cardiovascular health. Manage cholesterol. Keep cholesterol levels in check through a healthy diet, exercise, and medication if necessary. Seek medical attention. If you experience symptoms suggestive of a stroke or have risk factors, seek medical attention promptly. Quick intervention can significantly improve outcomes. It's essential to note that individual risk factors vary, and a healthcare professional can provide personalized advice based on your health status. Regular checkups and health screenings are crucial for early detection and management of risk factors. If you suspect a stroke, call emergency services immediately, as prompt treatment can minimize damage and improve the chances of recovery.
The information provided here is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or heard in this content. If you think you may have a medical emergency, call your doctor or emergency services immediately.